Hello everyone, we are from SGD B3. Now we are going to present our student project with the title Nasal Polyps. The introduction of each member of the group will be conducted later. I will go first. Allow me to introduce myself. My name is Carla Manullang with my last two digits are 146, and now I'm going to present about the background of the student project. Nasal polyps are benign growths of the sinonasal mucosa that are inflammatory and hyperplastic. As they have an ambiguous etiology and are susceptible to recurring, such conditions are difficult for the otorhinolaryngologist to treat. It is furthermore essential for the respiratory doctor to be aware of how to treat nasal polyps can negatively affect chronic obstructive pulmonary disease, notably for asthma patients. The next part will be continued by my colleague. Thank you.
Hello, my name is Margaretha Jesslyn with my last year's number is 248, and now I will explain to you the problem formulation, objective, and benefit. So from the problem formulation is what is the definition, the epidemiology, the etiology, pathophysiology, and what evaluation need to diagnose nasal polyp, and what are the differential diagnosis, and what are the treatment, and how to prevent nasal polyp, and what is the complication, and how is the prognosis. And then for the objective is to know the definition, to understand the epidemiology, to understand the etiology, to understand the pathophysiology, to understand the evaluation need to diagnose nasal polyp, to know the other differential diagnosis of nasal polyp, to know the available treatment, prevention and complication, and also prognosis of nasal polyp. For the benefit is for the student include improving students' knowledge regarding multi-aspect of nasal polyp. This literature review aim to increase one's understanding of the definition, clinical manifestation, etiology, pathophysiology, evaluation, differential diagnosis, treatment, management, and complication, and also prognosis of nasal polyp. Thank you.
Thank you for the opportunity. My name is Ningrum, and I will explain about the definition. Nasal polyp are benign hyperplastic that occur due to the growth of inflammation in the sinonasal mucosa. Patients with chronic rhinosinusitis are the most common manifestation of this disease, so that the two diseases are often related to each other with the term of chronic rhinosinusitis with nasal polyps. On the other hand, nasal polyp also have an association with aspirin exacerbate respiratory disease, certain systematic vasculitis, cystic fibrosis, and other similar diseases. Even though they are benign, nasal polyps cause patients to experience several disorders such as nasal obstruction, anosmia, rhinorrhea, and ageusia, which tend to reduce the patient quality of life.
Hello, my name is Kevin Andrian Candra with my last number 095. Today I will explain the epidemiology of nasal polyp. Globally, the incidence of nasal polyp in adults range from 1 to 4% with variation 0.2 until 28%. The epidemiological incidence in children range from 0.1% and this disease starts at the age of 20 years and is more common at age 40 years. The ratio of men to women is 2 until 4 to 1, and this disease has no boundaries of social class or race. That's all from me. Thank you.
Okay, hi. My name is Wilbert Purnamasidi with last three digit of my student number is 135. And now I will continue the presentation with 2.3 etiology of nasal polyp. So, etiology of nasal polyp, there are many of etiology such as T helper to cell-driven eosinophilia and elevated interleukin 5, cystic fibrosis, fungal-driven inflammation, response to exotoxin from Staphylococcus aureus infection, systemic disease such as polyangiitis or EGPA, genetic factors, in this case is HLA-A, and other etiology such as asthma, bronchiectasis, and aspirin hypersensitivity. Maybe that's all from me. I give it to my friend. Thank you.
My name is Dr. Adrianus with the last three digits of my student ID number 104, and I'm going to explain about the pathophysiology of nasal polyp. Apparently, the pathophysiology of nasal polyp haven't been discovered perfectly, as it still rely on descriptive and correlative data. It's often related with a disease called chronic rhinosinusitis. As for the mechanism of nasal polyp, its most contributing factor is aging, as it affects the body's normal physiology and biological function. In the case of nasal polyp, it affects the nose in the way it impairs the mucociliary clearance. It's also related with atrophy of nasal mucosa lining and reduced mucosal secretion. Hence, the mechanism I've explained above will contribute to the formation of nasal polyp. Also, in patients with impaired immunity, higher eosinophils levels in nasal polyps are found when they are infected by Staphylococcus aureus. Contributing factors are impairment in the normal function of airway epithelium, which includes pro-inflammatory cytokines levels increased, chemokines, stimulation of T helper 2, devoid epithelial lesion, Staphylococcus aureus toxins, and autoimmune antibodies.
My name is Aisyah Taqiyyaa with 3 last digit number is 076. 2.5 Diagnosis. Diagnosis of nasal polyp established by anamnesis, physical examination, and evaluation. From anamnesis, we can consider nasal polyp if the patient has symptoms such as anosmia, rhinorrhea, nasal obstruction, and nasal or facial congestion. On the other hand, history of chronic otitis media, epistaxis, pneumonia, bronchitis should alert the clinicians about other possible etiologies. Physical examination should include an anterior rhinoscopy or a nasal endoscopic examination. At anterior rhinoscopy, the clinician may be able to visualize the polyp and other neoplasma. If operation is indicated, clinician use tomography or paranasal sinus PNS CT scan. The diagnosis is confirmed when the presence of nasal polyp with 2 cardinal symptoms. That's all from me, thank you.
Hello doctors and friends, my name is Natalia with the 3 last digit student number 109. Now I'm going to present about the differential diagnosis of nasal polyp. The differential diagnosis of nasal polyp varies from first, rhinosinusitis, which is an inflammatory condition of the nasal cavity and sinuses. Second is the cystic fibrosis, which is a particular condition that produce thicker mucus from excessive mucus gland in the respiratory tracts, which cause the patient to have persistent nasal congestion and thick mucus that is difficult to expel. The third one is nasopharyngeal carcinoma, which is a type of cancer that occurs in the nasopharynx, especially behind the nose and above the throat. The fourth condition is other lesions such as squamosal carcinoma, adenoid cystic carcinoma, adenocarcinoma, lymphoma, melanoma, and fibrous histiocytoma. That's all from me, thank you.
My name is Nandhita Naaz with the last digit of student number 189, and now I will explain about the treatment of nasal polyp. Nasal polyps treatment aims to reduce the polyp size, lessen associated symptoms, and prevent recurrence. There are 2 categories, medicines and surgery. For medicines, intranasal or systemic corticosteroids should be tried as the first line of treatment. Giving corticosteroids to remove nasal polyps is also called medical polypectomy. For stage 1 and 2 polyps, intranasal and or oral corticosteroids are recommended for 4 until 6 weeks. And in refractory diseases, biologic medicines can also be used to reduce inflammation or swelling. Besides that, conditions that cause persistent swollen and inflamed tissue in the nose can be treated with other prescription drugs such as antihistamines or antibiotics. Besides that, the clearance of antigens, biofilms, and inflammatory mediators can be improved by low pressure and high volume nasal irrigation with saline. Lastly, surgery, including polypectomy and functional endoscopic sinus surgery, may be an option if the patient fails to respond to the therapy and the polyp is large.
Hello, my name is Caroline and my last 3-digit number is 016, and I will explain about the prevention of nasal polyps. So this condition actually can affect anyone, and although there is no definitive way to prevent nasal polyps, there are strategies to address their underlying causes and reduce their risk of their formation. The first one, avoiding irritants. So avoiding substances that can irritate such as smoking, pollution, and chemical fumes. And then the second one is managing allergies and asthma. So adherence to treatments for allergies and asthma can prevent inflammation in the nasal passage and sinuses, so can reduce the risk of polyp formation. And the third is nasal cleaning with saline solution. So regularly cleaning the nose with a saline solution helps to maintain nasal hygiene and removes potential irritants. And to prevent the recurrence of nasal polyps, there are some various methods that can be considered. The first one is surgery, and then the second one is intranasal corticosteroids. So this can reduce polyp size and enhance airflow in the nose due to their anticongestant properties post-surgery. And then the third is medications. So certain medications like furosemide and antibiotics and antifungals also can be prescribed. So that's all from me. Thank you.
Thank you for the opportunity. My name is Gede Saputra with last 3-digit number of name 018, and I would like to discuss with you guys about the complications of nasal polyps. So nasal polyps, often stemming from an underlying disease process, bring about obstructive nasal symptoms, disrupted sleep, and fatigue. Complications encompass mucocale formation, exerting pressure on orbital structures, potentially leading to exophthalmos, diplopia, and diminished quality of life, with several cases causing irreversible anosmia. Additionally, nasal polyps can result in recurrent sinus infections and rarely, more severe infections like in meningitis or orbital cellulitis. This is necessitating vigilant monitoring and potential antibiotic or surgical intervention. Furthermore, sizable nasal polyps can obstruct the airway during sleep, contributing to obstructive sleep apnea and daytime fatigue, culminating in a range of complications that significantly impact patients' physical and emotional well-being.
My name is Gede and Renathan with the digit last number 193, and now I will explain about the prognosis of nasal polyp. The prognosis of nasal polyps is generally good, but recurrence are high and long-term treatment is often required to prevent new polyps from developing. According to a study, 21.2% of cases relapsed 3 to 5 years after surgery. And according to another study, recurrence rate 6 months after endoscopic sinus surgery was 35%, compared with 38% after 12 months and 40% after 18 months.
Hello everyone, my name is Dewa Guptha, with the last 3 digit of name is 072. So today I would like to conclude or making a conclusion about the nasal polyps. There are 4 points here, and first of all, understanding nasal polyps is important since it is considered as a clinical manifestation of an underlying disease process. Second of all, nasal polyps are benign growth of the sinonasal mucus that are inflammatory and hyperplastic. Third, clinicians can diagnose nasal polyps if the patient has clinical symptoms such as nasal obstructions and congestions. Fourth, first line of treatment is polypectomy by using systemic or intranasal corticosteroid to remove the nasal polyps. So that concludes the presentation about the nasal polyp. Thank you for your attention and see you at the next opportunity.